well, so we decided to record a video for you separately, and we can also the second Saturday in August do a Facebook Live if patients want to come on and ask more questions that weren't already answered
and covered in this video. So hopefully we're going to answer all of your questions and you feel confident about the transition to concierge that's going to start in September.
Yes. And we wanted to kind of run an overview. I know that many of you have received our letter of why we're doing this. So the number one reason is truly time. We wanted to have time with you, our patients, and the way that medicine is moving, whether you decide to stay with us or not, we decided it was important for patients to understand kind of how the healthcare industry has changed. So given insurance reimbursement rates falling, we typically have to see more patients in a day to be able to, meet financial values. So if you're in a huge healthcare system, they call that RVUs. You have to see several patients in a day to be able to satisfy the hospital system. If you're in a private practice, you have to be able to see so many patients a day to be able to pay your stuff and stay afloat. And we didn't want to become a factory, essentially. The amount of patients that we would need to see in a day was going to mean we got about 5 minutes on average with you.
And one problem, please. Only one problem today. If you want to talk to us about something else,
Yes.
please reschedule. We didn't want to become those people.
And we are patients also. So we have functioned in the system, seeing our OBGYNs or, a specialist if we needed to. And they're great doctors. It's not that they don't want to talk to us. It's just they don't have time. And so it's a run-in, quickly blurt out a question, and then, okay, bye.
And we're not subject to any special treatment. Broken hand, had to wait an hour to see my ortho. So, it's not any different for us. So we understand.
So we get it. And we didn't want our patients to be that way. We love our relationship with our patients. We love remembering your kids' names and what they do, where they're going to college. And we like knowing what you do for a living and how you're eating and all of those intricacies. And we wanted to be able to keep doing that. And so in an effort to keep less patients and more time with you, this is why we made this switch. On average, most providers have 2,000 to 5,000 patients in a panel. Most actually cap at 2,000. She and I have more than that combined. So, combined, we both have over 5,000 patients. And we love to be able to answer questions quickly. That brings us joy and also, gets you answers fast. And as patients, we appreciate it if somebody would do that for us. But if we continue to have more patients, that wasn't going to be feasible. And so it was either change how we practice and become a factory or keep being personal with you. We chose that route. And given that we've done so, benefit-wise, you have same or next day visits guaranteed, 30 to 60-minute visits with us. If you get a cough or a UTI or fracture your hand,
conjunctivitis, oh my God, do I have pink eye? Come in. We're going to see
We'll just squeeze you in. You can text us pictures. We'll send antibiotics. We'll work it out. We'll send labs to you. We'll do what we need to get it done quickly so that you don't have to go to an urgent care and see somebody who doesn't know your history or know anything about you. So quick in and outs. If you need us to do that, longer visits with you at minimum 30 minutes to be able to counsel you on all of the vast knowledge we went and got on nutrition and exercise and everything. We want to be there to make you healthier overall. So we're really excited about that. Now, we had some great questions from the patients that came in. One question we've gotten the most is, are you still taking health insurance? Yes. We are going to still take health insurance. We grappled with that for a long time because health insurance and providers are not best friends. They dictate a lot what we can order, even if we know that it's best for the patient, and what medicines we can prescribe, even if we know what's best for the patient. And you've all experienced that firsthand, especially with a lot of these medications that assist, with metabolism and getting you healthier long term. So we grappled, but we decided to keep health insurance because it's easier for you if we do. If we didn't keep health insurance, you would need to submit a claim through your health insurance yourself. So we would have to give you an itemized receipt and you submit it. We didn't want you to have to do that. So given that we didn't want you to have to do that, we're going to keep taking health insurance. But we cannot affect your health insurance at all. Legally,
we can't do anything.
So we can't change your deductible. We can't change or modify your copays. We cannot change or modify how much we have to bill to insurance per industry standards. We can't change any of that. So from an insurance perspective, if you have health insurance, nothing changes with your health insurance and how you interact. This membership is just separate. The one thing that another patient brought up was, does this mean I won't be able to meet my deductible? No. If you come in, we will bill your health insurance. That will go to your deductible. Nothing changes with how we
your
interact.
annual labs that come
Right.
with your annual visit go
Right.
towards your deductible, towards your plan.
Right.
So that doesn't change.
Nothing changes with how we interact with your health insurance. The only thing that changes is a monthly membership. Now, we are also going to give patients the option to have cheaper labs. We worked with a lab company to get cheaper lab pricing, and we're going to be very transparent about that. We're going to give you a itemized thing that says this lab costs this much, this lab costs this much, so that you're aware. And then you'll have to sign a waiver if you choose to go outside of your health insurance that says I'm going outside my health insurance for these labs, and we won't charge you for the labs. They're included in your membership.
Yes.
So, but we wanted patients to see how much we had negotiated down those prices for you.
And that this isn't something, the cost savings that we negotiated go directly to you. This is not a profit margin thing for us. We're not making a cent off this. This is just what we negotiated on your behalf. It helps us because we get labs that we can't get your insurance to cover, and we can monitor and care for you in a better fashion.
Right, so we can get your labs more than just once a year, which is what most health insurances cover. We can check to see what your insulin resistance is, or how your hormones are doing, which is or your vitamin D, which, as most of you know, your health insurance won't cover anymore.
Dissect your thyroid, which you won't cover past the TSH. So
right, not really dissect your thyroid.
No.
no.
But lab-wise, thoroughly check your thyroid.
So we wish to be able to do these things for you. Those were the most common questions that we received. I don't think we've missed anything. We have been working with an imaging facility and to get reduced prices. So we're trying to get those cheaper too. That is a little bit more challenging. So that is, but especially for women for mammograms, you will know how I remind you about this all the time. So they're important. And so we're trying to negotiate if you don't have health insurance so that we can get labs, because for our patients who don't have health insurance, this is also going to be a great plan for you because your labs are going to be included. You get us all of the time. But we recognize that imaging is a barrier, and so that's something that
we're still working on, that we will constantly work on to see what we can do to make things better for you. Now, remember, please, that this doesn't start till September. We do encourage you to please sign up because we are having limited enrollment, right? 250 patients each is what we're hoping to keep. So therefore, we want you accounted for. We don't want later on for you to be on a waiting list because we didn't see you there. But nothing gets charged till September the 1st.
Right. So not until September. And so we're encouraging, many of you have signed up already, and we thank you from the bottom of our hearts for continuing to trust us with your health.
And it is an honor always to be participants in your healthcare.
Yes. And so we just encourage you to go sign up because the spots are filling. And the other thing is, if you decide that this isn't going to be for you, we understand. We don't want you to be worried to tell us that. We knew it wasn't going to be for everybody. And while that breaks our hearts because we wish we could keep all of our patients, I told one of my patients, I said, hopefully one day healthcare will change and it won't be this way.
Right.
And I would love that.
But this is what we've got.
Yeah, I would love for me to be able to get some time with you and not have to do this extra thing. I would love if that's how healthcare functioned. But we're working within the system that we have, and so if this isn't something for you, we will work with you to get you your medical records and help you, transition. We've been trying to find other primary care doctors, and so we will give you. We haven't had great. Not a lot of them are taking new patients.
Yeah.
So
we have two, but we're happy to get you their information and make it an easy transition.
And we'll go through that with you.
Right.
Yeah. So thank you so much for tuning in, and if you have any other questions, please message us through the portal. And we think the second Saturday of August, if questions are still lingering, we will do something like this.
And one last thing, sorry to interrupt, Doctor. One last thing, there are discounts for couple memberships, for family memberships, for you to pay quarterly, biannually, and annually. So you'll see those when you go to sign on, to choose what it is you'd like to do or how you'd like to do this.
You can always interrupt me. You're my mama. Okay, well, thank you so much. We appreciate it. Bye-bye.
Have a good weekend.